Hi, everyone. Welcome to HR1, Protecting Progress in the Child Nutrition Programs, hosted by the Food Research and Action Center. I'm Steve Hayward, FRAC's Communications Manager. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation and will send the recording and slides in a follow-up email. Closed captioning is available. To turn captions on, click Show CC in the bottom taskbar and select English as the spoken language. At the end of the presentation, we'll have time for questions and answers. To ask a question at any time during the presentation, please use the Q&A tab also in the bottom taskbar. With that, I'll pass it off to Clarissa Hayes, Deputy Director of Child Nutrition Programs and Policy at FRAC. Take it away, Clarissa.
Awesome. Thank you, Steve. And hi, everybody. So like Steve mentioned, today we are discussing HR1 and strategies for mitigating the harm of this bill, as well as protecting the progress that we have made in every state across the country. So this legislation passed earlier this year introduces significant changes that will affect millions of families and children across the country. So our goal today is to understand what these changes mean for the programs that you all work on, as well as highlight some strategies to keep these programs strong and accessible in every state. So I'm very excited today to be joined by some of my amazing colleagues at FRAC who will be joining me for this important and timely discussion. So let's go ahead and dive in. All right, so what do we know? I know that this may be a refresher for many of you, but HR1 was signed into law in July of this year as part of the budget reconciliation process. And obviously, one of the most concerning aspects of this bill is the unprecedented cuts to SNAP, or the Supplemental Nutrition Assistance Program. And I will just say that thanks to the advocacy efforts of many of you on this webinar, there were no direct cuts to the child nutrition programs included in this bill, as those were included in original proposals. So that is definitely a win and something to celebrate. But as you know, SNAP and the child nutrition programs are deeply interconnected in many ways, with participation in SNAP providing an automatic pathway to school meals, as well as acting as a proxy for other programs and the data needed. So at the end of the day, any changes to SNAP that decrease participation in that program will have a cascading negative impact on the child nutrition programs, and that is what we want to dig in today. Next slide, please. So with our limited time together, we are not going to spend too long on the specific SNAP cuts and the timing of those and the scope of those pieces. I will just flag that on our website, frac.org, we have many resources that do just that. So analysis, blogs, resources on the SNAP cuts and how they will roll out, including some Q&A guides on the new SNAP time limits, recommended actions to mitigate the harm of those, and as well a specific look at how CEP could be impacted, which I know Erin on the FRAC team will talk a little bit about that today. So want to plug these, definitely check those out after the webinar, and we'll make sure that all of these pieces get shared in the follow-up that goes out today. All right, next slide, please. All right, so with that said, we do want to start with some level setting of the changes that were included in HR1 to SNAP and how those will create direct changes to the child nutrition programs. So here on this slide are the SNAP provisions that were included in the budget reconciliation bill. And as you can see, many of the changes that were included were effective upon passage of that bill, and that includes eliminating SNAP Ed, imposing new utility deduction limits. So basically, this just changes what can be counted towards benefit levels and really penalizes low-income families for relying on, for example, internet access for work and education and healthcare. It also enforces stricter time limits, or what they're calling work requirements. It is restricting eligibility for non-citizens, so it removes SNAP eligibility for several categories of lawfully present immigrants, including refugees, individuals granted asylum, and certain survivors of domestic violence, human trafficking, and other humanitarian protections. And then the last piece under those that were made effective upon passage is the freezing of the Thrifty Food Plan. And that is a measure that basically adjusts the benefits for SNAP and summer EBT. So These changes and their impacts vary. Some of the provisions will outright remove access to SNAP for participants. And then on the other hand, some of these pieces will just make applying for SNAP so burdensome or the benefit level so low that it wouldn't be worth the effort for families to apply, which would also make those SNAP rosters decrease. And then, really, the biggest impact that this bill is going to have is what is known as the administrative and benefit cost sharing, which is going to start in fiscal years 27 and 28. But obviously, this is a huge thing, and states are starting to think about it right now. And without getting too in the weeds here, basically, what's going to happen is states are going to have to take on much more of the cost of administering SNAP, either through the admin costs, which before it was just 50%, and now it's shifting to 75%. And then also states will have to provide some of the matching funds for this program. So states are definitely going to start thinking about how to cover the cost of SNAP. So things like changing the program to reduce their rosters, or maybe cutting other priorities or things that they're funding in order to cover the costs of SNAP that they did not have to cover before. And I just want to emphasize that the magnitude of this really cannot be understated and what states are going to have to face in the years to come. So, next slide. So, with that said, the most effective way to ensure that millions of families aren't impacted by this bill is to reverse it. And thankfully, FRAC, along with many of our partners and national organizations, are attempting to do just that. So, hot off the presses, a bill was actually dropped today, which is Restoring Food Security for American Families and Farmers Act of 2025. That would reverse all of the cuts in H.R. 1, and that was introduced by Senator Lujan in New Mexico and Congresswoman Hayes in Connecticut. So while we are definitely focusing on the child nutrition programs today and what we can do in the meantime, I would say, reversing these SNAP cuts is obviously the pillar of all this effort. So if you are able to do advocacy and have the time, FRAC does have an easy portal where you can send a pre-populated email to your members of Congress urging them to pass this bill. So, next slide. So while we continue those federal efforts, let's go ahead and turn towards the child nutrition programs that we want to protect and make sure that they remain a source of support. Like we've mentioned, these SNAP cuts are really not happening in isolation, and they're going to directly affect the programs that serve children. So we are going to walk through school meals, summer, after school, CACFP, summer EBT, and WIC, and talk a little bit about how they're connected to SNAP, and then really just spend most of the time talking about ways to mitigate the harm of H.R. 1. So as you can see, we have a lot to cover. And with that, we're going to kick it off with school meals. So I will go ahead and turn it over to Erin.
Thanks, Clarissa, and hi, everyone. As Clarissa mentioned, there is a lot to cover, so let's get right into it. Next slide, please. So Clarissa just gave a really great overview of the SNAP cuts, and as she mentioned, there's more resources available online on our webpage through our chats that go into a deep dive in the specifics of the cuts. But I want to just re-emphasize and re-highlight those cost sharing, that administrative and benefit cost sharing that Clarissa mentioned starting in fiscal year 27 and 28. What we're really concerned about here is states trying to control SNAP costs by reducing SNAP rosters. And we know that when children receive SNAP benefits, they are directly certified or automatically eligible for free school meals without an application. Therefore, when children lose SNAP benefits, they lose their direct certification, their automatic eligibility for free school meals. And this increases paperwork burdens on the families by forcing them to submit meal benefit applications. It increases paperwork burdens on the school systems, and it negatively affects community eligibility. It affects schools' ability to implement CEP and maintain financial viability. So let's look specifically at CEP. Next slide, please. Our first strategy really to mitigate the harm of H.R. 1 and protect the progress in school meals is to support and protect community eligibility provision. Next slide, please. I'm sure all of you are familiar with CEP, but just in case, community eligibility is an option under the National School Lunch Program that allows eligible schools, high need, high poverty schools to offer free breakfast and lunch to all students. There has been tremendous growth in CEP adoption since it first became available nationwide in the 2014-2015 school year. Last school year, we had over 54,000 schools That's more than 50% of schools operating the National School Lunch Program use CEP to bring free breakfast and lunch to all of their students. However, there are still thousands of schools, 3,800 schools above the 50% identified student threshold that are not participating. So you can use FRAC resources, our FRAC database, to identify eligible and participating schools in your location and find which schools are not participating and start to work with them and ask them what is happening. What do they need to participate in CEP? Next slide, please. So as most of you know, community eligibility, the basis of community eligibility is something called the Identified Student Percentage, or the ISP. Identified students are those students who are directly certified, who are automatically eligible for free school meals without an application because they participate in another federal means-tested program like SNAP, or because they are categorically eligible because, say, they are unhoused or homeless. This ISP, the percentage or the share of identified students within a school or a school system, determines eligibility for CEP and federal reimbursement. So the higher the identified student percentage, the more federal reimbursement CEP schools receive. Likewise, the lower the ISP, the less federal reimbursement CEP schools receive. And the lower the ISP, it is much, much more challenging for schools to implement CEP and maintain financial viability. Next slide, please. So a little visual here, looking at those identified student categories again. There are children that are participating in Medicaid and meet income threshold levels, children that are participating in SNAP, TANF, FDPIR, and those who are categorically eligible. They are unhoused or homeless, they're in foster care, they're runaways, they're in Head Start. These children are automatically eligible for free school meals in application, and they count towards the school's identified student percentage. Steve, advance, please. As children lose access to SNAP, as the SNAP enrollments decrease, they lose their automatic eligibility for free school meals. They are no longer directly certified, and they are no longer counted toward a school's identified student percentage. Next slide, please. But keep in mind that once a child is determined eligible for free or reduced price school meals, they retain that eligibility for the entire school year, regardless of changes in SNAP participation, regardless of changes in household income. They are still eligible for free or reduced price school meals. And each CEP cycle lasts 4 years. So once a school locks into CEP, they can continue using those identified student percentages to determine federal reimbursement for 4 years, up to 4 years. And this is important right now because if you think about it, if a child was on SNAP in August and they were directly certified for free school meals in August, they can retain that ISP, they can retain that free school meal eligibility and can be counted in an ISP, even if they lose SNAP access in November or December or February. They're still counted. If they've already been directly certified this school year, they are still counted towards that school's identified student percentage next spring when schools decide to elect CEP. Next slide. With that in mind, we are calling on school districts to continue doing robust and comprehensive direct certification this school year, to extend eligibility to other household members where applicable, to work with your school counselors, your guidance counselors, your homeless liaisons, to identify categorically eligible children. And even if this is your first year implementing CEP, look at those April 1 numbers come spring. See if your ISP is relatively the same or even a little lower and restart your CEP cycle. This will get you another year or two past those SNAP cuts that we are anticipating coming to effect in fiscal year 27-8 and onward. Next slide, please. On the national level, we are working tirelessly with partners to maintain community eligibility as it currently stands. These are 4 key provisions of the community eligibility provision that really contributes to how it's functioned and contributes to the reach of CEP. If we were to lose any of these provisions, it would be devastating to students across the country. Schools would no longer be able to implement CEP. So on a national level, we're really calling to maintain community eligibility as it currently operates. Next slide, please. And with that, we always need to be championing and talking about the value and the impact of this program, the value it has for students and their families, for school nutrition departments, and the larger school community. What you see on this screen is a resource we recently developed in partnership with the Center on Budget and Policy Priorities. It looks at state level CEP participation data for last school year on the front page, and then on the back page of these fact sheets, we have matched school districts to congressional districts. So you can see which school districts are eligible for CEP and participating in CEP by congressional district. And this is available online. Next slide, please. Our second strategy for protecting the progress in school meals focuses on school breakfast. And we saw a lot of great news articles coming out during the government shutdown, praising schools for expanding breakfast programs and for expanding supper programs. And I know Clarissa will talk about that in just a little bit. But as these SNAP cuts go into effect, household food resources are going to decrease, household hunger is going to increase, and children's dependence on child nutrition programs is going to become even more important. So we're really calling on schools to implement robust breakfast programs. And the way that you do that, next slide, please, is include these two main ingredients in the key school breakfast recipe. Healthy school breakfast for all, so offering all students free school breakfast, and breakfast after the bell. Breakfast after the bell is key to increasing breakfast access and breaking down the stigma and the barriers that prevent far too many eligible children from participating. Next slide. There are a variety of ways that schools are implementing breakfast after the bell. They call it breakfast in the classroom. They call it second chance. They call it grab and go. The key here is that children are able to eat breakfast after the start of the school day in community with their peers. That school breakfast becomes part of the school culture and that children have access to it at the time they get to school. They don't have to arrive to school early. They don't need to be separated to eat breakfast out in the cafeteria. They get to eat breakfast when they get to school as part of the rest of their class day. And this really increases breakfast participation and ensures that children are starting their school day with the nutrition that they need to succeed. Next slide, please. We know that food and nutrition service directors can't make all the decisions in the school. Sometimes I wish that you could, but it's really up to principals, administrators, superintendents, boards of education. So one strategy we are focusing on to increase school breakfast this year is really engaging those decision makers within a school system. And we have a variety of resources available for you to help you do that as well. Next slide, please. So our third strategy, in my opinion, it is always a good time to talk about the benefits of school meals, to talk about school lunch being the healthiest meal that most children receive in a given day, to talk about the academic and health benefits of school breakfast. We don't need to wait until National School Breakfast Week or Farm to School Month or National School Lunch Week to talk about the importance of these vital public health programs. But one thing we also need to be communicating now is the connection between SNAP cuts and school meal consequences. Next slide, please, Steve. It is often misunderstood how cuts to SNAP impact school meals. And oftentimes we've been talking with policymakers and decision makers, and they'll say, well, we didn't cut school meals. Well, it's disingenuous to say that school meals were not affected in HR 1. Everyone on this webinar knows that cuts to SNAP hurt school meals. And we need to continue explaining that message and letting all of the decision makers, our policymakers, our representatives, our school boards, our media understand that cuts to SNAP are cuts to school meals, and explaining how these are connected and how cuts to SNAP will increase hunger in homes and hunger in the classroom. Next slide, please. Lastly, the role of state policy. In this change of shifting federal policies and a lot of national and federal uncertainty, the role of state policy is ever more important. Next slide, please. Ever since the end of the COVID-19 pandemic, we've seen tremendous momentum behind healthy school meals for all. We're excited that the 9 states indicated here in green have passed healthy school meals for all policy, but we need to protect them and make sure that those policies continue to expand to more additional states. The states here on this map in blue have healthy school breakfast for all policies or universal free breakfast policies. And then the states in that gold or yellow color are working towards healthy school meals for all. So anything that we can do to support these state policies and state policies that can support schools' abilities to offer free breakfast, offer free lunch, support the community eligibility provision is going to really protect students' access to nutritious school meals. Next slide, please. Few things to keep in mind as we start building out state policies. States are going to face increasing costs for SNAP, increasing costs for Medicaid. State budgets are tight, so we want to make sure we're passing and writing policies that keep states' costs down. And we have a variety of examples and partners across the country who have written really brilliant policies that we can connect you with that require SNAP outreach, that increase and enhance direct certification requirements. And all of our Healthy School Meals for All states talk about maximizing federal reimbursement and really getting schools to do Provision 2, to do community eligibility, to do within district grouping for CEP, to make sure that states are drawing down as much federal dollars as possible before they start tapping into the state budget. And as I mentioned previously, breakfast for all, healthy school breakfast for all is becoming ever more popular as a step towards healthy school meals for all. And while states are passing healthy school breakfast policies and universal free breakfast policies, we are strongly encouraging you to mandate that second component of breakfast after the bell. We know free breakfast alone is not enough to increase participation. It needs to be both. Breakfast after the bell offered at no cost to all children. And let's make sure we're defining what we mean by breakfast after the bell. That children are eating in community with their peers in their classroom. Not that some child who comes to school late is able to walk to a cafeteria and go get a breakfast. That's not breakfast after the bell. Breakfast after the bell is talking about community and that power of school breakfast and what it means when we all eat breakfast together as part of our school day. And with that, I'm going to pass it back to Clarissa.
Great. Thank you, Erin. Yes, so we are going to shift into summer and after school and CACFP. And like we've been saying, again, there were no direct cuts to these programs in this bill, but the cuts to SNAP will impact these programs. And the way that we see this happening is through area eligibility. So Steve, if you want to go to the next slide. So for those that may not be familiar with this, if you do not work on summer, after school, or CACFP, area eligibility is the method that is used to determine if a location qualifies to participate in these programs. And the magic number is 50%. So what this means is that at least half of the children in an area have to be eligible for free or reduced price meals in order for that site to serve free meals to all kids under 18 without requiring any kind of application. So once a site is approved, that eligibility does last for 5 years, which obviously is a pretty big advantage for program stability, and we'll talk about that in a little bit. So with that level setting, on the next slide, I'm going to just highlight what are the different pathways and eligibility pathways for participation in these programs. So to get to that 50% for summer meals, you can either use census data or you can use school data, which is the free reduced price meal data that Erin was talking about. For CACFP after school suppers, you can only use school data. So making a site eligible is reliant completely on school data and the availability of that. And then for CACFP and childcare settings, census data and school data is used to determine reimbursement tiers for this program. And if you don't work on CACFP, basically tiers are determined again by the percentage of low-income students participating in schools and qualifying for free or reduced price meals. And the percentage of that makes a difference in whether you're getting the higher tier 1 reimbursement or the lower tier 2 reimbursement, which is about 50% less than tier 1. So again, SNAP is informing school meals data, and school meals participation data is informing these programs that provide meals during the school day for younger kids and then during the after school hours and summer hours for school aged kids. So that's a lot of information. On the next slide, let's just kind of take it back and talk about why does this matter. So obviously, if participation in SNAP and Medicaid is decreasing, fewer children are being directly certified for free or reduced price meals. And that means that the area eligibility data that we just chatted about could be reduced, could be lowered, and some program sites that are just on that 50% threshold, maybe a little bit over, could drop underneath that 50%, meaning that they wouldn't be able to participate in things like after school meals or summer food, or with CACFP and childcare settings, they would just get a lower reimbursement. So that is not to say that these programs, couldn't qualify if schools are getting the applications and certifying kids, but we do know that that direct link to SNAP to these other programs is helping to make area eligibility data where we need it. So this is obviously the ripple effect that we need to anticipate and address when it comes to these programs. And then a quick kind of pivot. I just want to really highlight too that HR1 isn't just going to be affecting families when it comes to these programs, it's also going to be hitting providers too. So on the next slide, I just have a little bit of data here about what it means for the childcare workforce. A lot of them, nearly 40%, are relying on at least one public assistance program. In March 2025, a survey found that 68% of providers are struggling to meet basic needs. So really, these cuts are also going to undercut the workforce and the families that they serve. And this is especially important to acknowledge because this is a time when CACFP childcare homes are also struggling, as you can tell from this chart, with a drop in participation because of some of the administrative burdens that they're facing. So in order to support CACFP childcare homes, we need to make sure that the people who are running these homes and running these programs have the support that they need as well. So with that said, with summer, after school, and CACFP, what can we do to protect progress? So on the next slide here, what I really want to emphasize, and I guess I have a animation. Here we go. So at the end of the day, strengthening school meals programs and implementing all of the policies and pieces that Erin just mentioned are going to help also protect area eligibility data, which is critical for summer, after school, and CACFP. So even if you're on this call and you are not a school and you don't work with a school or the school districts, being familiar with the pieces that Erin lifted up and how all these things are interconnected is really important as we move forward with the next couple years. The next thing that I want to flag is that area eligibility is good for 5 years. So if you are working with sites or you are a site or a provider that is in an area that has always, been around that 50% threshold, you are able to redetermine your area eligibility within that 5 years. So you don't have to wait until the 5 years is up in order to do that again. So if you want to take a look and see what the current data says about your site, you can go ahead and do that and lock that in for 5 years if that is something that you're worried about. And again, this is mostly for those sites that have always kind of been close to that threshold cutoff. And then the last thing I'll just mention is that summer food and CACFP childcare, it is school data is one source, but like that slide earlier mentioned, you are also able to use census data. So after school suppers, I would say, are the most limited. They're not able to use census data, so school data is all that they can rely on. But with summer food and early CACFP, you are able to use census data, which just provides another pathway. So if you aren't familiar with that, I would get familiar with that. And, there's a little bit more flexibility there. You can average census blocks to get to that 50%. There's just a little bit more wiggle room if you are kind of on that cusp of 50%. So with that said, let's quickly go through a couple different things that I wanted to lift up when we think about these programs and protecting progress. So the first is that at the end of the day, we want to increase and improve program access here. Like Erin mentioned, families that are facing SNAP cuts are going to be looking to other programs for the nutrition that they need. And we know that in summer, after school, and CACFP, they are underutilized programs. There are many eligible sites across the country that could participate in this program, but are instead, serving meals out of their own budget. And that's because they don't know how to operate the program. They don't know what it is. It's too burdensome to operate. So we really need to work together to eliminate some of those barriers. And I would say just a renewed investment and support in these programs to make sure that there are these other options for families. So looking at the funding in your state for after school enrichment programming, are all of those programs serving meals? Looking at childcare centers and homes in your state, are they all connected to a CACFP sponsor? Are schools participating? Because we know for the most part, schools often have economies of scale and the infrastructure to support these programs. So I'm just challenging you, if you are working on school meals, think about summer and after school and CACFP and how you can also work on those programs. We also need to make sure that we are boosting outreach and promotion. Like I mentioned, with providers, I think there's also a really big lack of awareness about this program for both summer and after school meals. So there's an opportunity to not only spread the word to eligible programs, but I think also to let families know about these programs and just kind of get rid of some of the misinformation about these programs and connect families to them. State agencies and state partners often have outreach campaigns and different materials that you can use to promote these programs, so you don't have to do this all from the ground up. There are many partners who are working across the country to promote these programs and increase their reach. And then really the big piece is just around supporting legislation that would strengthen these programs. In both summer, after school, and CACFP, there have been many key bills that have been identified by partners that would really change the access to these programs and would really address many of the issues that we see coming down the line because of HR 1. And on the next slide, I have just a little overview of those. So on the CACFP side, there are many partners who have been working on this for many years and continue to get these bills reintroduced. But there are two marker bills that would really transform CACFP. So the first is the Child Care Nutrition Enhancement Act, and that would do amazing things. It would add 10 cents per meal. It would eliminate tiering, which we were just talking before about how tiering reimbursement levels are different depending on your free reduced price information. So getting rid of that would obviously change that and make it a lot easier for family child care homes to participate, and then allowing providers to claim meals for their own children, which is not currently allowed under the program. And then the other one is the Early Childhood Nutrition Improvement Act. So it adds reimbursement for an extra meal or snack, adjusts CPI, simplifies reporting, and addresses some of the paperwork burdens that we know exist in CACFP. So these bills together would, again, just make the program stronger and help to address many of the things that could happen because of the budget reconciliation bill. And then on the next slide, I just will quickly talk about the Summer Meals Act. It's another bill that has been introduced for many years now and would make improvements to both summer and after school meals. The first, it would streamline summer and after school into one program, which we think would really benefit those providers who are serving the same kids at the same sites year round, but have to switch depending on what time of year it is from one program to the next. And then really fitting to our conversation today, it would lower the area eligibility threshold from 50% to 40%, which is something that many partners have identified as a priority because we know that many areas do not have concentrated areas of poverty if they're suburban or rural, but they would still benefit from these programs. And it would also just help to align these meal programs with federal funding for after school programs like 21st Century. In order to get funding for that, you have to be at 40%. For after school meals, it's 50%. So these programs aren't talking to each other or aligning, even though they're serving the same kids. And then it would also provide a third meal during the summer because right now you can only do up to 2, and then also provide some funding for transportation. So child nutrition reauthorization is most likely not happening anytime soon, but as we think about opportunities and legislative vehicles to get some of these pieces added to it, these are really the Summer Meals Act and the CACFP bills I just mentioned would really make a difference in these programs. So that is it for me. I will go ahead and turn it over to Kelsey now to talk about summer EBT.
Great, thanks, Clarissa. Hi, everyone. My name is Kelsey Boone. I am a Senior Child Nutrition Policy Analyst, and I focus a lot on summer EBT. Next slide. So many of these have been touched on in the previous discussions we've had on the different programs, but I will briefly go over how HR 1 impacts summer EBT. So this program relies heavily on its process of streamlined certification, for which those of you who are not deep in program details is a process where families who are either eligible for free or reduced price school meals or who are in programs such as SNAP, TANF, or Medicaid receive summer EBT benefits automatically. As HR 1 limits the number of children on SNAP, it will mean fewer children who are directly certified for school meals and mean more families must complete summer EBT applications. This will not only increase burden on families, but it will also increase administrative burden on states. And there will also be a subset of children who will lose access to the program entirely. So summer EBT eligibility includes any child on SNAP who falls within the state's compulsory age range, regardless of their enrollment in an NSLP or National School Lunch Program school. This means children on SNAP who are homeschooled can receive benefits. If those children lose access to SNAP, they will no longer be eligible to receive summer EBT. And finally, the Freeze to the Thrifty Food Plan will mean that the summer EBT benefit, which these benefit increases are based on, will remain relatively stagnant, which will lead to benefit adequacy issues over the coming years. Next slide. All right, so currently there are not direct threats to the summer EBT program, but more the ripple effects that we have been mentioning throughout this presentation. That being said, we want to be sure we're able to protect the enormous progress that we have made in the 2 short years since this program began. The first I would like to discuss is state application system improvements. Next slide. Oh, never mind. As I mentioned, much of the summer EBT automatic enrollment process hinges on streamlined certification. And if individuals are no longer on SNAP and don't turn in or fill out school meal applications, they will need to apply for summer EBT, which could increase the numbers of applications a state has to process. Due to this concern, we are really encouraging you to push your states on any needed improvements to their summer EBT applications and systems. So when it comes to summer EBT applications, there are a few best practices that we'd really like to lift up that could help families that are accessing the program. The first is to ensure that the application is in easy to understand language, so not heavy on jargon or acronyms, is very straightforward, and only includes the necessary questions that are listed in the regulations. You can push your state to not include or have an optional field for Social Security number or even the last 4 digits to ensure families feel comfortable filling out the application. I know this is a very tricky ask at this point, but they are not required to have a Social Security number or even the last 4 digits on the applications according to summer EBT regulations. So we really lift that up as a best practice. To maximize accessibility, you can have the application in multiple languages and ensure it is able to be filled out on a mobile phone or computer or printed off and submitted. And finally, we really encourage your state to link their application system to their eligibility system, which can ensure a quick answer on eligibility for families. So in turn, we will need to ensure that communications and outreach are really prioritized. So due to the need for families to apply for the program, there will need to be a renewed focus on outreach to eligible families. So when it comes to outreach and communication, there are a few best practices, again, to keep in mind, particularly for your state agencies. The first is having a comprehensive summer EBT website, and this could include elements such as, but really not limited to, answers to frequently asked questions, a link to their application, contact information to get questions answered, and links to additional food resources. The second is having a communications toolkit to share with partners. There are many examples of states with solid communications toolkits that are linked both in the FRAC case study, which has a QR code here, as well as our outreach toolkit, which can be found on our summer EBT webpage. The third is forging partnerships with other organizations to expand outreach to diverse populations. So these partners can include nonprofits that serve immigrant households, parent associations, school officials, anti-hunger organizations. The lists are kind of endless as far as partners that could have an interest in this program. And the last is to ensure that your state is supporting cross-promotion of school meals, SNAP, summer meals, and summer EBT, so that families can really maximize their access to all the nutrition programs that they could be eligible for. Next slide. Another way we can protect the program is by building the case for it through data. Next slide. So we encourage you to collect data on summer EBT from your state agency because participation data for summer EBT hasn't been collected at the federal level in 2024 and possibly may not be available for 2025, let alone the granular data on how families are really accessing this program. So having data on the effectiveness of the program in your state can really help strengthen your case if for some reason your state were looking to drop out of the program, as well as to build the case for other states that have not yet opted in. We suggest the following as data points to ask from your state. I know not all states will have this granular level of data, but any that they have would be really helpful to understand. So that includes administrative costs to understand how much is this costing your state, how many students receive benefits through streamlined certification, ideally breaking that out into students who came through different streams such as free reduced price school meals, SNAP, TANF, and Medicaid. How many applications were submitted and what portions of those applications resulted in benefits, what the redemption rate was both overall and among SNAP households, what the expungement rate was, and how many new cards were issued and how many of those were actually activated through a process called pinning. Next slide. And finally, we are concerned about state summer EBT retention. Next slide. So this past summer, so summer 2025, participation in the program was very similar to 2024. However, we did have 2 states drop out of the program, and they were Tennessee and Indiana. But we also had 2 states join the program, Alabama and Utah. We're still not quite sure where 2026 will land and have not heard of any states pulling out for summer of 2026. But we really want to ensure that all states remain in the program. Next slide. And right now, one of the biggest threats we're seeing for program retention is states opting into state-run programs and opting out of summer EBT. Next slide. 2 states this year, Tennessee and Iowa, ran their own summer nutrition programs as an alternative to summer EBT. Tennessee's program was completely state-funded and had a similar structure to summer EBT, but only gave benefits to children in certain counties that were on SNAP and TANF. Iowa's program utilized funds from USDA Summer Demonstration Project funding to run a food box type program. We have heard of a couple of states that have been interested in looking into the Iowa model instead of utilizing summer EBT, which is why we are very concerned. Next slide. So the Healthy Kids Iowa program is the one we're really looking at as kind of a threat to state retention to summer EBT. And it was designed to allow families to pick up $40 worth of additional food per summer month and was estimated originally to be able to reach 65,000 children. And according to the Iowa Department of Health and Human Services, only 54% of estimated children received this food in the month of June, which was just over 35,000 kids. This is in comparison to the over 240,000 children who would have been served by the summer EBT program. The program did cost USDA $9 million and actually ended up costing the food banks much more than anticipated, with one food bank in Iowa estimating they had to spend between $700,000 and $800,000 of their own dollars to run this program effectively. Food pantries also faced a lot of challenges with the cost of the program, as well as lack of additional food storage. And families struggled both with the quality of the available food, and they were not always given appealing or culturally relevant options, despite the state originally assuring families they would be given healthy and fresh options. So we are very concerned about this program taking hold. Next slide. This administration's USDA has really shown particular favor of food box programs, and we are, like I mentioned, concerned about states opting out of summer EBT to run a similar program. Right now, the funding for these programs is limited, and Iowa ran their program, like I said, under a summer demonstration project. So there's no separate source of funding for these programs, and they are expensive. These types of programs have a very narrow reach and really rely heavily on food banks and food pantries to not only operate the program, but to put in funds of their own to really make it function. And they also keep families from making the type of food choices that work for them. So FRAC currently has a policy brief about these programs and how they compare to summer EBT. And we'll be looking at creating more research sources that show some of the findings from Healthy Kids Iowa to kind of show the ineffectiveness of the model itself. But those are to come. And I will turn it over to Kate now to talk about the impacts of WIC.
Awesome. Thank you, Kelsey. And thank you everyone for staying on the line. I know this is a significant amount of information. As you may have seen in the chat, we're going to send the slides, or we're going to send this information to you after the call. So please hang in there. We just really want to share ways that you all can help ensure that these programs are protected. So I'm Kate Scully, and I'm the Deputy Director of WIC here at FRAC. And as we know, WIC is a critical piece of the nutrition support provided. And without WIC, millions of pregnant and postpartum individuals, infants, and young children would not have the nutrition support they need to grow and thrive. Next slide, Steve. So just to landscape us where we are with HR1 and WIC, as my colleagues have shared, HR1 passed with devastating cuts to critical programs. While WIC is not directly impacted by this bill, we do know that families who participate in WIC also rely on programs like SNAP and Medicaid. And indirectly, WIC is impacted due to adjunctive eligibility, which is a process where individuals who are already found eligible for SNAP, Medicaid, or TANF can also be deemed income eligible for WIC. This process makes WIC easier to access for applicants and puts less of a burden on the state to recheck income eligibility when they've already done that for other programs. However, if a household is cut off of SNAP or Medicaid due to HR1, then their adjunctive eligibility for WIC is also impacted. When they come to certify or recertify for the program, they now will have to supply that income information to verify their eligibility. And with over 80% of WIC participants also participating in SNAP, Medicaid, and/or TANF, this impacts a large portion of the WIC population. And while this may sound like a minor inconvenience, we all know that families already face numerous barriers to accessing WIC or many of these programs. So any additional barriers that hinder access can have really broad impacts on the program. So today I'm going to talk about 2 ways we can protect progress that we have already made in WIC. So much has been done over the last many years to increase access, to increase participation, to make the program better, and we want to protect all of the strides we have made. So the first way about protecting the program is to protect current access to WIC. You're so good, Steve. So on the federal level, WIC can serve all families, no matter their immigration status. But under TANF reform, or the Personal Responsibility and Work Reconciliation Act, states are given the option to limit participation in WIC to citizens and certain qualified immigrants. So if a state does choose to limit WIC in this way, I just want to note that WIC is federally funded, so that state will be forfeiting a portion of their WIC allotment because the USDA will account for that restriction and the fact that fewer people will be participating and will adjust the funds that state is getting. So it's something to remind your states of if they are thinking about this. But right now, we only have one state, Idaho, that currently has enacted this restriction. But there are other states that have or are considering legislation that could limit access to programs or cause even greater of a chilling effect on immigrants' participation in benefits programs, including WIC. So just to highlight the bills that we are currently seeing enacted, for everybody on this call, as I mentioned, the Idaho bill does restrict WIC benefits for individuals without legal documentation. The state just passed this bill in July, and they're currently working on implementation of this new restriction because WICs do not gather immigration information, so they need to figure out how to gather that information and then how to implement this new rule. We do have a Louisiana bill that does not specifically apply to WIC. However, it is a series of bills around data collection that would require the gathering of information on citizenship and immigration status, around the receipt of benefits and the cost associated with that. And it also includes reporting that information to immigration enforcement. So this is where we're seeing that chilling effect and that concern for people not applying for benefits that they are eligible for. And then in Oklahoma, I think this is a really unique bill and one I would not have been worried about in other environments, but they passed a bill that would require a study of establishing a unified and streamlined eligibility and enrollment system for programs including WIC. And I know this would be beneficial in so many places. Co and cross enrollment can be really fantastic for program access. However, in this environment, we need to look at legislation like this closely to ensure that WIC's allowance for enrollment of immigrants does not become impacted if it's linked with other programs that do have restrictions. So just wanted to flag these three for you. On the next slide, we have a resource we are working on. This isn't finalized yet, but should be in the coming days, and we'll be posting this to our website. So to assist with advocacy around these and any proposals that would impact access to WIC, we at FRAC are working on these one-pagers that provide information about the impact WIC has nationally and on states. So this is a preview that we're working to finalize. In addition to this federal level document, we're working on creating this document for each state. So if your state is thinking about limiting access to WIC, you can share that with state legislators, with the administration, to show what the economic, health, and overall benefit of WIC is to the state, and what will be lost if that program is restricted. So stay tuned. I'm sure we'll be sharing that out with everyone once it's finalized. And we welcome feedback on those as you see them. If you're thinking we're not touching on a specific thing that you need or messaging is unclear, please let us know. And then the second way we can protect progress in WIC is about implementing allowable state flexibilities. So we know that only about half of those who are eligible for WIC actually participate in the program, and anything that will increase barriers to WIC will only make that participation lower. So as we're seeing battles that might increase those barriers, we want to think about what flexibilities are currently available in WIC and make them permanent or use them in states. So first, I want to talk about the Modern WIC Act at the federal level. So the USDA has provided waivers that allow WIC agencies to conduct certification and recertification appointments remotely. This came about during COVID and has proven to be really impactful for the program, has increased participation, and allows households, a mom with a young baby, to not necessarily have to go into the WIC agency for everything, but to be able to do her interview remotely, which gives that flexibility for her and her household. So without action, this waiver will expire in September of 2026, which I know sounds like it's far away, but feels like it will be here very soon. So to address this, on the next slide, there's more information about the Modern WIC Act, which has been introduced in the House. This bill will make that remote certification and recertification options permanent. Additionally, it'll require that those remote options are fully accessible to households and in alignment with the Americans with Disabilities Act. It also has other provisions that are great for WIC around requiring WIC agencies to provide their nutritional assessments within 90 days. And it also allows households to get benefits more quickly, so they can get benefits and then provide that nutritional assessment later, because that can take some time. So this allows households and families to receive the nutrition support they need when they need it, and certainly to still satisfy all the requirements of the program. And it will allow them to get that nutritious food. So the Modern WIC Act is currently introduced in the House, and we have only 43 co-sponsors. So we want to see that number increase. I'll be putting in the chat, we have some resources at FRAC, a one-pager on the Act, as well as a way for you to contact your legislators to ask them to co-sponsor this. We'll also be working on a Senate companion bill so that we can make sure that this does move forward and families can continue to access the program in the way they've grown accustomed to, and states can have that flexibility. So in addition to the federal level, states also are able to make WIC more accessible in their states. In 2023, the USDA issued a memo that clarified these flexibilities on ways that WIC certification can be streamlined. States are taking advantage of many of these flexibilities, which is fantastic, but there are still gaps and there are still ones that they can utilize. So I just wanted to share that with you all today. You can check your WIC state agency plan or talk with your state agency to understand what flexibilities are being used. And I'll share the memo in the chat as well, so you can check it out for yourself and see what works. But some of these flexibilities are just common sense. So it's around making sure that WIC agencies can allow electronic documentation, and that people can send that documentation to the WIC office in advance of their appointment so that they can be notified if they're missing anything, or that those certification appointments can go more quickly. Additionally, if you have one document that proves you're a resident, and your income, that it can be used for both, that you don't have to provide a different document for those determinations. On the next slide, I have a couple more that would really, give states flexibility on, if you're providing documentation for your income, whether it's 28 days or 31 days. Also that temporary 30-day certification period so that you can get your benefits immediately. So this is a flexibility allowed in states. The Modern WIC Act would would codify this, but this is something states are allowed to do if they want. And then the certification of newborns. So WIC agencies have been strongly encouraged to use that adjunctive eligibility that provides the mother or the household members with access to WIC, and then brings in the child. So as soon as the child is born, that they can be eligible for WIC without having to go through a certification process. So again, common sense flexibilities that would give states additional support and allow them to more easily certify folks for WIC. So we would love to see all states implementing all of these if that is possible. And then I think that's it for me. Clarissa, I'm going to pass it back to you for Q&A, and I'll put those, the items I mentioned in the chat.
Great. Thanks, Kate. And I know we covered a lot, and we see this as the beginning of a conversation. So we will be holding some more webinars on this topic and really digging through. But thank you all so much for joining. We have been answering the questions that have come through as we've gone along. So if you had one, I think we got to it. There is one about advocating for school breakfast that, Erin, I'm going to turn it to you to talk through rather than type that all out, and then we'll close up. So Erin, if you want to tackle that.
Thanks, Clarissa. And Michael, I am searching for that. I think I have it, but if you want to email me, I can send that too. So I'll drop my email in the chat. So the question came through, let's pull it up, about how we can help advocate for school breakfast. What are the best resources to use, besides FRACs, obviously, and most impactful steps to take as a community partner, as a school district employee, as a researcher, and as a policymaker? First and foremost, engaging your school food service director, right? We do nothing without the school food service director, and understanding their operations, understanding their limitations, and understanding their needs. So if you do not have a relationship with your local food service director, reach out and start forming one. In my opinion, food service directors are really the best of the best. They love their jobs. They're there to serve their children, and they want to make these meals as nutritious, as culturally responsive, as desirable, and as popular as possible. But they are operating, under absurdly tight budgets and with a lot of constraints right now. The COVID-19 pandemic brought in a lot of challenges, some of which have not gone away. They're still facing a lot of labor shortages. So I would start by engaging your food service director and seeing where they are at and what they need, and building off what you have. As I mentioned, we are looking to work and engage the decision makers within a school system, right? The principals, the superintendents, also very, very, very busy professionals who want the best for their students, but don't always know the connection between school breakfast participation and students' academic outcomes or students' health outcomes. They don't always know that strong school breakfast programs result in improved test scores. So really doing that advocacy and being that spokesperson. It's very easy for people to say negative things. Be the person that tells the truth. Be the person that says the positive thing and talks about school breakfast and its connection to improved health outcomes, improved academic outcomes. Talk about the nutritional requirements around school breakfast and the changes that are coming down the line. As a researcher, there's a lot of research out there connecting school breakfast participation to these improved outcomes. I think those are always great, always beneficial. Michael and I were kind of having a discussion in the chat too, particularly around community eligibility provision and healthy school meals for all, and really looking, can we quantify the labor impact? Can we quantify, the dollar impact of going to CEP, and what does that mean when school nutrition departments no longer have to process applications? What are they doing instead? So as a researcher, we have lots of opportunities, reach out. And as a policymaker, I say, listen to your constituents, right? And do what's best for your kids in your area. So that was a really quick personal opinion overview of what we can do. But as always, if you want more information, please reach out to us.
Awesome. Thanks, Erin. So next slide, we'll wrap up. Thank you all so much for staying on. And I think we're a little bit over, but if you have any questions, please feel free to reach out to FRAC. We are here as a support, whether it be resources, policy support, or connections to other orgs and providers. So just wanted to thank everybody for joining. Thank you to my co-presenters for sharing such great information. We will make sure that these slides get out, and we look forward to connecting with you soon. Thank you all.